All right, everyone. Thanks for your patience while we start our recording. For our folks who can't make it today, welcome. We are so excited to be having a webinar here for you to think about Midwife Lobby Day and also our legislative priorities for the year, even if you can't make it down to Olympia next Thursday with us. Many thanks to our sponsors who will give us a yummy breakfast, Orion Medical Supply, longtime supporters of the Midwives Association of Washington State, and Quilted Health, who's going to provide appetizers for dinner. Um, and then you can get dinner and drinks on your own if you'd like. We just so look forward to seeing you all. Look at all those lovely faces. And we'll be trying to take a picture again in the middle of the day. So as you probably know, Midwife Lobby Day is next Thursday, February 13th, in our state capital of Olympia. You can still register. We can't guarantee appointments. We can never guarantee appointments, but the longer we had to get in touch with your people, the better but we're still happy to have you. And especially if you live in a district with other people who are coming, we've probably already tried scheduling visits for you. So please come join us. We're still happy to have you. We also still have a little time. If you really waited till the last minute, you still can do today by the end of the webinar by like 2 p.m. If you still want to pop in for a dinner reservation, if you think you'll probably be there for RSVP, and also for a lunch order. This is truly the last minute because our amazing Irene Fudena, one of our interns for our Lobby Day planning team, is going to go ahead and call the restaurants with those numbers, around 3 o'clock today. So thanks for getting those in. If you still want them, we'll be providing those links for you. We're lucky this year that not only are we MAWS, but we now have a new organization in our state, the Washington Association of Birth Centers. So really cool. You've got all of us working, some overlap, lots of overlap on your behalf and for families. For those of you who like to know where we're going, this is just a quick, overview of the day, basically the kind of things we're going to cover. We have our amazing lobbyist, Amber Alvarez, here for the first half hour. So that'll be our chance to hear from her, as well as to get questions answered from her. But don't worry, you'll be seeing her next Thursday as well, because she amazingly opens her home to us for a place to land in the morning and the early afternoon there before her kiddos get home from school. So thank you, Amber, as always. Would you like to say a hello?
Hi, everybody. Good to see you again.
Yay. And we also have Siri here, Siri Larson Iverson. Know that she's always working really hard for you in the background, but she probably won't be having too much upfront to say today, but we're super grateful for her co-chairing this team. And we hope you'll join us. And now for our legislative priorities. Do you want to start, Amber?
Sure, I'm happy to. So the first one is familiar to all of you, is maintaining our licensing fee cap, and that's been our priority for a number of years now. I think some of you predate me, but I think that, since I started in 2007, we have had this cap. So we're fortunate that we have been able to get it into what's called the maintenance budget or the 4-year outlook. Those are kind of interchangeable terms, meaning the legislature expects that it's going to be in the budget. So our champion this year is Clyde Shavers in the House, and then we had identified Moncadingra in the Senate, and she said that they were not required to submit individual provisos for things that were already in the 4-year outlook. So that's great, but she still, deserves the thanks for being willing to champion that. So we're in a pretty good place. You may have heard that this is a really significant, terrible year for the state budget. So working in Olympia right now between new federal directives and a really significantly challenging state budget that has a $12 billion shortfall over the 4-year outlook. is pretty severe. So we're not taking anything for granted, and reminding people that we really depend on that licensing fee cap, and it's nothing that we would ever want to have considered to be cut. So we do have some talking points on this one. You're probably familiar with them, and feel free to take a look at it. We initially got the licensing fee cap. I think legislators were pretty convinced, but we even had a legislative commission study that showed that backfilling the licensing fee cap at the Department of Health, since the law says all professions must be self-sustaining and pay for their own regulation, the backfill that they provide, which will be $300,000 this biennium, and we've been at that level for a little while, holding steady, just more than pays for itself in the quality of care and avoided procedures the licensed midwives provide.
Amazing. Thanks for that. And, just one thing I feel like I can say is that a lot of people know this, right? Like, unless they're new, they've heard us say this before. So, Amber kind of implied that, but, people say, oh, yeah, yeah, yeah. But, it's still important. Like, this is a lot of money, and it is important, and we are super thankful. So it's often something we can say thank you for, but, because they've supported us in the past as well. I'm going to go back here with my slides if I can figure that out. Yeah, there we go. And if you want to go to the next one, Amber.
Sure. And just so we will be able to just kind of continue on before or not having to come back to this page. Next, we're going to talk about House Bill 1824. And then we have a couple of budget items after that that are kind of more hopes and dreams at this point than probably being able to happen considering budget woes. But, we always like to seed, the next things we're going to be talking about so that they're familiar to legislators when we come back next time. But House Bill 1824 by Stephanie Bernard, Representative Stephanie Bernard, would allow for substantial equivalency for birth center inspection. So that means if you are accredited by the CABC, that you do not need to also comply with the state DOH inspections because that would be duplicative. There is a precedent for this. Ambulatory surgical centers do this. So we have some hope that this will not be controversial and will be able to save the state some money, some midwives and birth centers some hassle, and it will be signed into law. So we're going to be asking for you to advocate for this bill. Okay, next slide. So, and I don't know, Kristen, if we should take questions along the way or if you want to wait till we complete the priorities.
Does anyone have questions on those first two, priorities there? We can kind of put them all back up here before we kind of move on.
Okay, let's go on then, and we'll see after if folks have questions. So, one thing that we have really been trying to figure out, it's taken us a while to figure out, what we really can go for in this legislative budget. One area that arose was that very insufficient payment for a situation where a client is transferred to hospital. That payment, as you can see on the slide, 366, when you've maybe spent an extended period of time with that person. So we have a proviso request to pay the same, have Medicaid pay the same regardless of whether or not the baby is caught at the birth center. So that's a facility fee. We also were working on, how we have been working on how we're going to try and fix that issue for home birth midwives as well. We haven't quite figured that out yet. But that's something that we will continue to work on. So for the birth centers facility fee question, we've estimated that that would be about $930,000 for the biennium, so for the 2-year period.
Are you ready for the next?
Yep. Okay, so this one, maintaining funding for distressed birth centers and L&D units. This is something that is in the current biennial budget, and we're asking legislators to continue this program. It funds both distressed hospital L&D units as well as birth centers. The $1 million is the portion for birth centers. I did talk with the Hospital Association yesterday and let them know that we are going to be asking for this. And I did ask them for their proviso language and the amount they're asking for, just so that we can be better informed about that. And they haven't got back to me, but we will have that information for Advocacy Day. For people, and a lot of them are here, but that have gotten these grants from the Department of Health, it's been very helpful, and we would love to see this continue.
Yeah, and it looks like we did actually get some questions about the previous. So I'm going to go back to that one because, we've got some really great questions in the chat, and I think it is a really helpful. I'm going to come and see. Oh, we're recording, so I won't come see all your faces, but that's what I would prefer to do in this moment, is to see your faces. But basically, I think if I'm understanding the questions, one path, right? When you're thinking about a transfer, like a hospital, if a level 1 hospital is transferring to a level 3 hospital, they still get a facility fee, which is one way that a facility operates, right? And for a birth center, their normal facility fee, since we got it raised, in 2022, I think it was, up to $2,500. That's what they get, right? That's what we get if you, own a birth center and somebody has their baby there. If you transfer at any point for any reason, you get $366.68 for the facility fee. With home birth, we have no facility fee, right? We did get that supply fee, right, raised 2 years ago. Used to be $75 for our home birth supplies with Medicaid, and now it's up to $500. Obviously not as much as we would like, but that was given for our supplies. So there is no transfer fee at this point, right? You can charge like a little bit of money for seeing them for 15 minutes. You can charge a couple 15-minute increments, and I think we figured out the most you can get, Deborah could say, maybe is $200 or $300. And that can be charged no matter where someone's having their baby. But obviously it's not very much money, right? If you're with somebody for 48 hours and they transfer, and they have their baby somewhere else, then that whole amount, when you break up that global fee, what's it end up being, $800 or $1,000, that money goes to whoever attended the birth, whoever catches the baby, we say, right? Whoever guides and facilitates the birth. So, what we were sort of wondering is there may be a path called an interrupted delivery fee, so we can still get that money. So, even when we transfer, we're really in the stages of trying to figure out how this works with codes that were created by the AMA, right? The American Medical Association, who didn't have us in mind. Imagine that, right? And so there is no facility fee for home birth. We've also really kind of brainstormed and we will continue to work on can we get more codes, but that's that's a many years process that's been tried before and failed, but maybe it'll happen this time, right? We want to keep working on all the things. But as of now, we don't have a mobile facility fee. There's no mobile clinic fee or anything that we can charge. Does that answer your question?
But
Do you want to unmute
Kristen,
and ask?
Additionally, the birth interrupted or the delivery interrupted would apply to everybody because that is provider based.
Yes.
Right.
If we
And I
can
think
get
that's
clarity
regardless of location.
yeah.
Right. And Penelope,
have
one
a-
of the things that we were exploring is having the provider fee happen no matter what, like, whether the baby was there or not. But since it is equivalent with whoever catches the baby, MD, LM, CNM, whatever, it has such broad implications across the state beyond licensed midwifery care. So it just takes it'll take a little more creative thought.
I have a quick question too. The birth supply fee for home births, is that paid even when a transfer happens, or is that only if
Yes.
you use the code
It
for
is
delivery?
paid.
Oh, great.
And I know I've seen some stuff around about how to make sure you're getting that paid. You want to make sure you're billing the right codes and stuff. If somebody has it, maybe you can put it in the chat. Because I know some people, when we got that fee raise, they were like, oh, I don't even think I was getting that $75. So you want to make sure you're definitely getting the $500. Um, I also see Penelope, thanks for your question. When are we going to ask for this birth interrupted fee? So to be honest, this is it's a process. We as a team, we meet weekly, this time of year, and then half the year we meet every other week. And I can promise you, we have been talking about this for literally years, so much so that we sometimes want to like interrupt each other and just say, why are we saying the same things over and over again? Because we've been trying to work this out. We wish it was simple and straightforward. And so as long as we've been talking about this, it literally took us until just a couple weeks ago to discover this idea of a birth interrupted fee as like a possible pathway to get an increased reimbursement for home birth transfers. So it's like we tried to like rush it and see if we could make it happen, but it's also a really bad year. And they're telling us we'll be lucky if we can still keep our cap on our licensing fee that we've had for more than 15 years. So basically, it's not going to happen this year anyway. And we were just a little late to the game with the like brain discovery that this might be a path. So I hope
And
that's helpful.
yeah, and still feel free if you want to talk to your legislators about, the home birth challenges as well, and that we would like the birth interrupted fee, or we'd like something else, or we would like reform of the labor management code if at all possible. Please feel free to talk about those things. Like I said, just we're really unlikely to get these kind of add-on items anyway, so we will be back with it. And yeah, just this is the worst budget we have seen since the recession. So it's most of the legislators that are here right now were not legislators when that happened and have never had to deal with a really significant budget challenge before of a $12 billion shortfall. So I think it's going to be really hard. And there are, with the potential of kind of Medicaid cuts to expanded population, or, I have hope that, that that even though Governor Ferguson isn't talking this way, that the House and Senate majorities will be considering some tax increases to try and stave off really painful things for people, but there will be cuts. And so, everybody should be aware of that.
And we're giving you the reality picture so but the whole point of us being there is to put a face to these issues. Anything we start talking about this year, a lot of times it's hard to accomplish something in 1 year. So we can start talking about these things we care about. And sometimes what we discover is that actually our legislator really loves that idea and really wants to support us. And then we can go next year, right? And really work on that specific issue. It's super helpful. We'll show you there's a form you'll fill out after each visit, and you tell us stuff like this. Gosh, my legislator really thought this was a cool idea and really wants to help with it in the future. So that all of this is really helpful, and it's how we've had so much success is because we're going there, we're building those relationships, we're telling them the things we care about, we're helping them understand how all these things impact us. And in terms of federal stuff, we don't want to go too deep into it. There are potential impacts, but really the state budget problem is a problem in and of itself. It's our regressive tax system. So you can read more about that online. All right, let me kind of move forward a little bit here because I know we're going to lose Amber at some point, and just want to make sure we have time, and we can always hang around and talk about other things later as well. we wanted to make sure we let you know that one of our big things, which is one reason at the end that we were like, oh, we have a little room in our legislative agenda, is because we thought that we were going to be going forward and talking to our legislators about making sure that licensed midwives could have the opportunity to work at federally qualified health centers. Right. So you may know federally qualified health centers in your area. You may not realize that's what they are. Right. But CMAR, you can name others here in the chat if you know other ones so people can recognize what we're talking about. This is one place where migrant farm workers get their care because they can't get it anywhere else, right? And so also, but it's also like in my county, it's like anyone on Medicaid who needs dental care, you go to Columbia Valley Community Health Center, right? Like this is where people get care when they don't have other options. And sometimes it's a really great place to get care as well. Hopefully it always is, right? Because it is for the most vulnerable populations as well. Basically, there used to be a few midwives who worked at Neighbor Care, and then they were told they couldn't be employed there anymore. This is years ago, decades ago. And ever since then, the narrative has been licensed midwives can't work at federally qualified health centers. But then we know down in California that Javon Muhammad, they had a birth center with CPMs, licensed midwives down in California. Kiki Jordan, was running that birth center down there and providing care to, you get to provide care to anyone who walks in the door. It's amazing because there's all this lower overhead if you have a birth center. This way you can, anyway, there's lots to it. But basically, like if you graduate and you just want a job, or maybe you've been a midwife a long time and you just want a job, you just want to do prenatal and postpartum care for people, you want to work for really vulnerable populations, like we want this to be resilient populations as well. Any vulnerable population has to also be resilient, right? And so we want this option for licensed midwives to be able to have these jobs, these steady jobs. And we go to be like, okay, we're going to do an amendment to the state plan, and we bring this to the healthcare authority. That's who, manages Medicaid here in Washington. And she's like, well, let me check with the feds, Center for Medicaid Services. And turns out the way our plan amendment is worded, we already can do this. So it's totally kind of amazing. And yet, there's a lot more steps here, right? So now we need to make sure the federally qualified health centers know that they can employ us if they want to, and they need to include us in all their job descriptions, right? And, all of these things. They need to know we can get loan repayment from the state level, for being LMs who are working at an FQHC. So all these things are really cool. We have work to do. And if you're interested in being on this task force with us, we are going to start having meetings once lobby day is over, and once the session is over, to work with community health center groups and help them.
I'm sorry, Ashton.
Oh, somebody's not muted. Can
Thank
you mute
you.
yourself? I don't know who you are. Somebody's like on the phone or something. I know how it is. You're a midwife, but okay, thank you. And so basically, we're going to start helping them understand who we are, what do we do, and now especially with our license extension, it's really kind of perfect timing to realize this, that they really should want to hire us, because any of us who have the license extension, we're like amazing employees, right? And we don't even need somebody to help us write prescriptions anymore if we have that license extension. So yeah, I don't know if there's any questions, especially for Amber, because she's going to have to pop off here. But this is just pretty exciting, I think. Feel free to unmute yourself, especially if you have a question for Amber. And thanks for those who are helping monitor the chat. Yes. Okay, cool. So that's just exciting. And yeah, we also wanted to alert you to federal initiatives that are happening right now. You can just go to the NACPM website and click on, their voters guide, but there's really cool stuff happening that you can plug into. And a big reminder here, and this is really true for state stuff too, when we're advocating, calls and Zoom meetings are going to be what makes the difference. So just sending emails isn't as effective as we want it to be, right? Signing petitions, like, just figure out what matters to you, right? And make those phone calls, schedule those Zoom meetings. And of course, many of you are going to come in person, which is huge. So yay. Thank you so much, Amber. And I will make sure people get your email. It's also on the legislative agenda. And so check out these cool, these cool federal initiatives, which will make a difference, right? Because if CPMs are being able to serve people on TRICARE, that's going to impact us here, right? There's stuff in here about midwifery education. There's stuff about, making sure birth centers can take care of folks. So really good stuff. Thank you, Siri. I'm just putting this back up here again. Maybe you've seen it before, but these are some of our amazing numbers that are Washington State specific. Dr. Wendy Gordon and Elizabeth Nethery and others published in the Green Journal. It's open access. Somebody needs to mute. And these are some great numbers to be able to share with people, to just show how awesome we are if you're ever needing or wanting to do that. I'm not going to spend a lot of time on this, but I wanted to make sure you had this QR code with your phone. You can grab it if you want. If you missed our annual meeting to just hear about what we've been up to this last year, many of you probably know, we finalized everything for the license extension for prescriptive authority. Deborah, is that number higher now than 20 LMs that you know of in terms of who has gotten the license extension?
I haven't heard anything new for that number. I feel like people are kind of trickling in slowly, so it might be up by a couple numbers, but not a lot yet.
Yeah, but exciting that for those who are doing it, and maybe we can talk at the end, like what people are finding about it or give each other tips. Again, these are just past things that we have achieved. And here are some great resources if you ever are needing them. Specifically, the state maternal mortality review report really talks about midwives. Like we should be giving good care to people like we do and making that care more accessible. For logistics, for any of you who are here for logistics, we'll meet at 8 a.m. at Amber's house. Please try to get there at 8 a.m. Please try to plan your parking and everything so that you can be walking in Amber's door as close to 8 a.m. as possible. We'll have some breakfast there for you. We will have coffee this year. Last year, the coffee got messed up. So this year, that will not happen again. We will get you your coffee and your tea. We'll be there. The address is here. From this, we'll have like a tiny little, gathering where we kind of remember what we're doing and give a little briefing. And then you will go with your team lead to your appointments. So you'll be finding your group and figuring out what appointments you have for the day. This is your base camp. You can leave stuff there, although please get your stuff out of there by the time her kids will be returning home from school. We'll do a group photo sometime around lunch. We'll let you know. There is a lunch option. Like I said, do that order. Maybe we can put that in the chat for anybody who is late to your lunch order. And afterwards, we'd love for you to stay. I mean, rather than sitting in traffic, stay, come with us to Mercado, get your free appetizers, get a drink if you want, get some food if you want. Quilted Health is providing those apps and with, our breakfast from Orion Medical Supply in the morning. So we're super lucky. It's a super fun time. We come together in community. It's one of the few times we gather these days in person. It's a great opportunity. We kind of go around and debrief and talk about our day. It's usually pretty fun.
Hey, Kristen, quick question about parking. You were very specific saying get your parking situation in order. Can you say more about that?
Yeah, so we have a different video that we made a long time ago so that we don't have to say the same thing every year for people who've come many times. But there are some slides. There also this document at the bottom, Siri will pop in for you. All the details you need are in this Google document, which we will keep updating, but there's parking info that you can read about. So, and it's all there. But basically you need to plan ahead. The earlier you get there, the better parking you get. The later you get there, the further you're gonna have to figure out how to get to Amber's house because it gets busy. The buses are free. And we do a lot of walking. Be sure to wear your walking shoes. And there's something about walking on marble that really hurts your feet, even if you're like a lot of person. So you will be walking. Don't wear your stilettos. Yeah, like I said, the video is a little old, but it does have parking stuff in there as well. And there's some slides on the website as well. But probably the easiest thing is to go to that Google document. Hopefully that's helpful. Basically, if you signed up but you need to cancel, please let us know, even last minute. You're like, oh no, I can't make it. Oh no, I'm at a birth. Please, please, please try to text me or ideally use the cancellation form. That would be the best way because we really need to know if you're not going to be there because we don't want to ghost your representative if we told them you were coming. So we can figure it out in Scramble, but we do need to know. Maybe you've already discovered the group text option, WhatsApp. We've all been really respectful of each other in the past. So if you're a little leery of group text stuff, I have found everyone to be really respectful. So let's hopefully we'll continue that good community. But it's a fun way that you can ask questions to anybody. You can post pictures. That's pretty fun. It's just been a fun way for us to all have community in a virtual way while we're there. And then we'll post some minimal, reminders in the upcoming days as well. We started last year kind of inviting everyone to wear a purple scarf, and we've heard good feedback that like if you're there by yourself or you lose your person you came with, that like knowing who else is in our group can be really helpful. You can always just like join another group or say hi to people with purple scarves because you'll know they're with us, which is pretty fun. And Deborah, thank you so much for getting us these cute little stickers as well that we'll have for you.
We almost had a problem with the stickers because they didn't arrive yet, but I called this morning and they're rushing them.
Oh, thank you. Well, it'll be what it'll be, but thank you for checking on them.
Kristen, will you guys give us a handout of kind of the slides with the talking points? Or do we have to remember all of that?
Yeah. So the best way to get to that is from this Google document that has everything in it. You can click on the legislative agenda, which actually here's your QR codes. So the legislative agenda, and we're still finalizing it. So I wouldn't print it yet if I were you, and we will have a printed copy for you on the day of. But you can see we're kind of in there finalizing, but it's pretty well solid on most things and nothing's wrong. It's just that we might keep, wordsmithing a bit and massaging. But go ahead and grab that legislative agenda, grab those talking points. And the way we think about that, like what we presented with those slides, that's pretty much the legislative agenda. That's what we're going to give to our representatives. That's what they'll see. We'll email them that. Some of them look at it, some of them don't. You can't leave paper with people, but we'll make sure you have this QR code to give it to them. It will be up on the website. I haven't gotten it quite up there yet, but I want to wait till it's finalized. And so your representatives can also reference the web page. And which is that web page you'll see at the bottom. It's not finished yet. So that's kind of how you get those things. And then the talking points, that's really something that we've developed over time. You can read through that. So you really kind of see how we might talk about it. And then what you do is you think of your own words that kind of go along with the talking points, right? So like, you're not meant to like memorize it. It's just giving you a little bit more. So you can kind of think, how would I talk about this with my representatives? And also no stress. If you literally look at none of this, if you literally remember nothing, it's so important that you're just there, that you say, hello, I'm your constituent. I'm so grateful to meet you. You can always say, do you have any questions about midwives? Right? Like you can just talk about midwifery care. You can talk about how you want to serve clients, talk about something that's important to you. It's great, if you tell a little story, but keep it short. One of the other documents we have in here for you is called the 9 Steps of a Lobby Day Visit. And that can kind of tell you how the visit goes if you want a little more information, thinking of how it flows and what to expect. But again, you're going to be in a team, no stress. You can literally just sit there and observe. We do think it's great if everybody can say, yes, I'm a constituent, hi, or I'm a student, hi, I'm a midwife, hi. But other than that, you're not required to talk. But we also encourage you to, find your voice as well.
And Kristen, if I can just jump in for a second, if you're a student coming, this is no different than sitting with a midwife and watching what they say to their patients and then trying to figure out your own words to do this too. Because you have less time in a lobby day meeting than you do in a prenatal visit, and you have to get a bunch of stuff across. So it's just trying to figure out how to say the right words. You'll have a team leader who will model that for you a little bit, and feel free to jump in and say what you can. And if you feel like talking, and then the leader will just jump in and say the stuff that you forgot, just like what you're doing in your practicums.
Really good point. And, there's also like people who just sit through their whole first lobby day observing, and that's great. And we hope you'll come back. Yeah, perfect. This other QR code on the right, please make sure one person on your team, probably not your team lead, right? This can be a really good contribution that you make, especially if you're not interested in talking, right? Is to be the person who fills out the response sheet after every visit. because sometimes it's busy. You're like running from one to the next, right? So maybe you take a few quick notes if you don't have time to fill it out, and you make sure it gets filled out before the end of the day. So you can look in there now to see what, what is involved. It's not super involved, but it helps catalog that information so we have it for next year and for when we're doing our planning and trying to find our co-sponsors for our future efforts. Any other thoughts or questions here? This is the video I was talking about that has the logistics stuff like parking and stuff like that. And there's some stuff on the website about like what to wear and basically business casual, comfortable shoes that aren't crazy dirty tennis shoes, right? So again, it's a little bit old. There's no more Dash Bus, but if you want to watch it, it still applies. This is just one of the main web pages where things should be linked from. I definitely have some updating here. Oh my God, look at my little baby. She's 7 now. Oh. So that you can always go there, but really that Google document is going to be where we put stuff if you're coming and you want just like, what do I need? We have a quick links document that one of our Lobby Day team members just updated today. So again, we'll be in teams. Have fun. It's totally fun. It looks like, y'all, it's going to be sunny on Wednesday. So just keep hoping that sun stays for us on Thursday and we have really nice weather because it's so fun when that happens.
There is a lot of in and out of the buildings and walking outside. So make sure you are dressing appropriately to stay warm, but also to be able to strip things off in between.
Really good point. If it's going to be wet, you want your raincoat, that kind of thing. Those of you wet ciders remind, but I always have to like, I'm almost about to leave town here in the middle of the state and I'm like, oh my gosh, I need to bring my raincoat. So, and then we have just one little MAWS eternal reminder here about the, please update your contact information. Otherwise, people can't potentially find you as a midwife or birth center unless you update your stuff on Wild Apricot to make sure that that is reflected on the website, as well as for us to be able to be in touch with you as MAWS members. Always, we want to thank our consumer members. We're super grateful for you. You are why we are here. Any of you who are midwives or students coming, bring consumers with you. That's like the best when we have, babies and families at Midwife Lobby Day talking about midwives. Many thanks to all of you who are going to come down, just being here and being engaged. We love that. But also, those of you who are going to make it, this year or next year, so awesome. Our amazing lobbyist, Amber Olvanes, who opens her home to us. Super thanks. Our amazing team that meets weekly to just get this all organized for you. A special thanks. I mentioned Irene Fudena is one of our interns for our Lobby Day planning team, as well as Lakeisha Hobbs, who's here, I think. Thank you so much. And Jada McDonald, who is taking her NARM right now and is still on our team, organizing all of your visits and getting them scheduled and everything. So if you see them, I didn't put their pictures up here. I should have, and I'm sorry I didn't do that, but thank them. And oh, there's Jada. Look, okay, we at least have Jada. This is what we hope for, some super sun on Thursday, but if not, we'll just enjoy the rain as much as we can. I always like this with everybody with their eyes closed. This is me over here. It makes me think the future is bright and beautiful. It's so bright. We even have to close our eyes sometimes when we're taking pictures. I know sometimes that probably feels hard these days, but it's true. I believe it sometime. Again, this is just thanks for joining us today. Keep up the good work in the field. This is what it's all about. That's my first little baby there. And what else? Team leads, please stick around. We super want to just talk with you for a few minutes if we can, although most of you already know what you're up to. And I think that might be the end. Oh, congratulations, FISA, for the Health Equity Award at the Washington State Public Health Association Conference this year. FISA will be at Lobby Day and is one of our board members. But that's it. We're here and you're here and I'm so glad. So let me stop this, and I think it's good to see you all. Does anybody else have other questions or things? I wanted to make sure to get through everything in case people need to go. Yeah. What else? I think I'll stop the recording probably, just that way people can feel more comfortable.
Kristen, we would